Don't wait until you start limping to start taking care of your knees. Let's do this today. Hello, welcome to Talking with Tanya. I made this podcast so I can share healthy habits for healthy living. The way I kind of come up with content ideas is that I kind of live life as healthily as I could. I take notes on where I can improve so I can then implement it into my own life. So recently I went to visit my family, and my stepdad was recovering from knee surgery as he was suffering from severe pain. His recovery was rough, from sleepless nights to intense discomfort, but what stuck with me the most was when he said, "Take care of your knees. Do what you can to prevent this." And I wouldn't wish this on my worst enemy. So then that had me thinking, and I asked him, like, what was wrong with your knees? Why did you need the surgery in the first place? And he had said that his knees lacked cushion and that his bones were starting to rub together. So then naturally, later I started to look more further into this, and I wanted to know exactly what it was. And it sounds a lot like osteoarthritis. Osteoarthritis is the condition to where the cartilage, the cushion in your joints, start to break down over time. This leads to pain, stiffness, and swelling as the bones start to rub together. So then I started to think, like, how common is this? Am I going to get affected by this one day? Like, I like to know these things so I can prepare myself in advance. So then I looked into it and I said, how common is this? It turns out very. According to Medical News Today, osteoarthritis affects around 500 million people worldwide, with 32 million cases in the US alone. And according to the World Health Organization, cases have increased 113% since 1990. That number is a little too close to comfort for me. So then I asked, what are the risk factors? Well, being female, for one, so I for sure got to take care of myself. Obesity, high impact activities, previous injuries, and genetics. I mean, what can you do? And it's not just the knees. This can affect your wrist, hands, elbows, shoulders, ankles, hips, and even the spine. Because this happens in areas where cartilage absorbs the shock and helps smooth joint movement. Joints that are used more frequently, like the hips, knees, and the spine, are particularly vulnerable. But even smaller joints like those in the hands and the wrist can be affected. Since there's no cure for osteoarthritis, prevention is key. So let's talk about the major causes of joint wear and tear. For one, excessive weight. The heavier you are, the more pressure that you put on your joints. I know losing weight's not easy, but what's something small you can do every day to help yourself in the long run? Consistency is key, and then just build off of that. Another possible factor could be repetitive strain. So this is for the athletes, the construction workers, the laborers, anyone with high impact activities like running, jumping, kneeling, putting constant stress on your joints leading to gradual damage. So I'm looking at you, adrenaline junkies and parkour enthusiasts. But high impact activities which can then lead to injuries. Even if you heal from an accident, long-term issues can still arise. If you love extreme sports, just be mindful of how much stress you're putting in your body. Hey, to each their own. And the last factor, malalignment. Poor posture and improper movement, especially when lifting heavy objects, can cause joints to wear down faster. Be mindful and practice good form. So now that I've gone over what causes joints to wear and tear, let's talk about how to keep them strong and healthy. Cartilage is the cushion between your bones. It absorbs shock and prevents friction. It works alongside synovial fluid, an egg yolk-like substance that lubricate the joints. It delivers nutrients and removes the waste. So when cartilage breaks down, then it leads to pain, stiffness, and inflammation, eventually leading to conditions like osteoarthritis. So how can we keep our joints healthy? Well, we can make certain lifestyle adjustments that can help us reduce inflammation, which is the body's response to injury, infection, or harmful substances. Chronic inflammation often develops slowly and may not show immediate symptoms. So we might not even be aware that we could be inflamed already. By the time it becomes noticeable, it may have already contributed to disease, joint damage, or other health issues. This is why prevention and management are important, and they're key to keeping inflammation in check. In osteoarthritis, an imbalance occurs where cartilage is struggling to repair itself due to inflammatory chemicals called cytokines, which activate enzymes that break it down. Diet can play a key role. Consuming too many refined sugars, refined carbohydrates, and processed meat can increase inflammation. So foods like hot dogs, lunch meat, sausage, bacon, the bacon, pastries, and white bread can contribute to inflammation. Other risk factors can include alcohol consumption, smoking, and a sedentary lifestyle. Sedentary meaning you're not getting off your ass enough. with about 80% of U.S. jobs being sedentary. This word is hard. With about 80% of U.S. jobs being sedentary, it's easy to neglect exercise and healthy eating habits, which makes it vital to stay mindful in today's world. While minimizing risks are important, there are ways to support your joints. Cartilage is made up of water, collagen, proteoglycans, and chondrocytes. So collagen-rich foods can play a key role in cartilage health and regeneration. Foods like bone broth, fish, poultry, and egg whites are rich in collagen, so they make great options. So I once saw a TikTok on a woman talking about how she was reversing her husband's wrist pain from giving him bone broth. And so if I find the video, I'll try it and tag it in here. But yeah, it's very interesting. Vitamin C is essential in cartilage production and can help protect against cartilage breakdown. Vitamin D and calcium are also crucial for bone health, which directly supports cartilage. Omega-3 fatty acids are also beneficial as they can help reduce inflammation and support joint function. I'm also a big fan of herbal remedies. That's just who I am. So since inflammation is really damaging to joint health, here are a few herbal remedies and spices that could potentially help. Turmeric, which is known for its anti-inflammatory and pain-relieving properties. Ginger, another great anti-inflammatory. Green tea, which is rich in antioxidants, which also help to fight inflammation. Devil's claw is also used for arthritis and muscle pain relief. Cayenne pepper has capsaicin, which has anti-inflammatory properties, which can help alleviate pain caused by inflammation. And willow bark has been used for pain and inflammation and has been used for conditions like osteoarthritis. So a quick disclaimer, I am not a healthcare professional. You should not use these to replace any prescribed medication, and please consult with your doctor before using any of these. Thank you. I'm just someone who enjoys learning about health and wellness and sharing what I've discovered. So keeping your joints happy is the goal, but sometimes things can happen, So let's take a look at some of the common knee injuries that come up often. So the most common knee injuries include meniscus tears and the anterior cruciate ligament, or ACL for short, injuries. The meniscus acts as a shock absorber, providing cushioning and stability in the knee. It is C-shaped, made of cartilage, and there are 2 in each knee. Meniscus injuries typically occur due to twisting motions, deep bending while lifting heavy objects, or direct impacts to the knee. The severity of a meniscus injury determines the necessary treatment. Minor strains or small tears may heal with ice, rest, or proper care, while severe tears may require surgical repair. If you experience a popping sensation, significant swelling, or limited range of motion, it might indicate a more severe tear and it might need some medical intervention. The ACL is one of the key ligaments in the knee, responsible for stabilizing movement and preventing excessive forward or twisting motion. Think of it like a strong rope that connects the thigh bone, the femur, to the shin bone, the tibia, and it helps keep the knee aligned and secure. So an ACL injury typically occurs due to sudden stops, quick changes in direction, improper landing when you jump, or direct trauma to the knee. Like the meniscus injury, the severity of an ACL tear determines whether surgery is needed. Partial tears may heal with rehabilitation and physical therapy, while complete tears will need surgical reconstruction to regain full function of the knee. Okay, so now we've gone over what could go wrong with the knee. Let's talk about what could go right for the knee. Flexibility is about how your joints and muscles can stretch, and mobility is more about how well your body can move and stay balanced. And having both good mobility and flexibility is super important for healthy knees. When the muscles around your knees, like your thighs, hips, and butt, can move well, this helps your knees straighten and bend the way they're supposed to. This keeps everything working smoothly and prevents extra stress on parts of the knees that aren't meant to handle it. Tight muscles, especially from sitting too much, can pull on your knee joint in weird ways and make it harder to move more comfortably. So over time, this can lead to aches or even injury. Also, your knees don't work alone. They depend on your hips and your ankles too. If those areas are stiff, your knees might have to work harder and end up getting hurt. So staying flexible and keep your body moving helps protect your knees and keeps you feeling good when you walk, squat, or climb stairs. While flexibility and mobility are key to keeping our knees in tip-top shape, sometimes pain and discomfort signals us that it's time to get a professional opinion. If your knee pain isn't going away, it's messing with your daily life, or it feels like it could be more than just a little soreness, it might be time to check in with your doctor. Signs like swelling, redness, trouble walking, feeling like your knee might give out, not being able to bend or straighten your leg could point to something more serious. And if your knee pain is waking you up at night or sticking around for weeks, don't just wait it out. Get it looked at by a pro so you can heal faster and avoid making it worse. That's it for today's episode. I hope this information helps you take proactive steps towards joint health. Don't forget to stay active, be mindful of what you put in your body, and be kind to your joints. Thank you for listening. Take care of yourself. Peace out.